Hi, and welcome to Beyond the Pelvis. I'm Laura Haraka, a somatic practitioner, breathwork facilitator, and someone who's been on the healing journey myself. I know what it's like to live with chronic symptoms and feel disconnected from your body, and I also know how powerful it can be when we start to listen, slow down, and heal from the inside out. On this podcast, we talk about the mind-body connection, nervous system healing, pelvic health, and all the messy, beautiful layers that come within learning to trust your body again. Whether you're brand new to this work or deep in your process, I'm so glad you're here. So let's dive in. So welcome back to another episode of Beyond the Pelvis. And today I'm so honored to welcome Heather Arrigo. Heather is a former client and a true success story. She came to me struggling with chronic bladder urgency and frequency that had taken over her life. And through mind-body healing, somatic work, and nervous system regulation, Heather experienced a powerful transformation. Her story is one of hope, resilience, and what becomes possible when we listen to our bodies and trust the healing process. Welcome to the podcast, Heather.
Thank you. Thanks for having me. It's so good to see you again.
I know, it's so good to see you too. And it's so good to see you now feeling better than when we used to meet.
Totally. Yes. Although I liked talking to you before, I prefer talking to you like this.
Exactly. So I'm wondering if you can share a little bit about yourself and the start of your bladder symptoms.
Yeah. Well, I'm in my 40s, I guess, and I'm in Massachusetts. I'm a teacher. I'm a high school teacher of a few things, and I have a son, Rocco, my partner, Tyler, and I teach yoga, actually, also, yoga instructor, English as a second language teacher, health educator, and Italian, certified Italian teacher also. So teach a few things. I have a Reiki certification. So
You
I do
have a lot of things going on.
Yeah, I do a lot of, I'm like all over the place. I actually just wrote a book.
Oh my goodness.
Yeah, which was so random. It was more like I had 3 pugs pretty much the last 20 years of my life, and just lost my last one last year. I know, so sad. He was just about 19. And I wrote this book as like a way, almost like, I guess thinking back, even through the lens of this, it kind of ended up sort of being like a journaling process, but it really was just a way to kind of memorialize them. But it is in the format of like a story. And so just looking into like publishing that at some point.
Oh, how exciting.
Yeah, so a lot of different things.
So I'm wondering if you can tell us a little bit about your bladder symptoms, when they started, what was happening in your life then.
Yeah, so I never was a person with really any type of pain. This, for my story, and everyone's story is different, I didn't grow up where I can pinpoint back something to childhood, right, where something happened or I had been living with this and it sort of came and went. This was a very specific moment in time, like a very specific incident, and it was the birth of my son. So the pregnancy was fine. I actually really enjoyed being pregnant, and I had a C-section. I had a C-section in the hospital, and obviously I was nervous. It was sort of unplanned. I went in for a checkup, and I tell this story all the time. I remember still have the visual of like leaving school, and like I was gonna, it was February, before February break. So it was a Friday before break, towards the end of my pregnancy. He wasn't due until March. And I had this whole plan, like I was going to finish decorating his room. It was just like really looking forward to the break. I said bye to a couple teachers on my way out, and I was going to an ultrasound, and I loved them. They were fun. You got to see the baby. My partner was meeting me there. So it was just like a great start to the week off. And we get there, and the technician or the nurse was just like taking a really long time. And I remember being like, is she new? Like, what is going on here? And like, she would leave the room, she would come back. I got moved to a different room and still like not registering. Like, I was like, they're just having trouble seeing something, and finally she brought in a doctor. He put me in like a different machine where he was looking around, and then they both came back in and they were kind of like, so we're going to get you upstairs. We're going to get you delivered tonight. And I was like, my response was, looking back, obviously I was in shock. Like, oh, you can't do that. My mom's in Florida. Like, that's what I said. Like, that's at all a logical thing to say, And they were like, well, you can give her a call. And they were like trying to be nice to someone who had like gone offline. But so they got me upstairs, they got me hooked up. They were able to push it to the next day with monitoring me. But I just remember I went into total like panic. I wasn't ready, I wasn't thinking it was going to happen that day. And everything went fine. I went in the next day for surgery. The whole C-section went fine.
Must have been very shocking to...
Looking back, yeah. I'm like, of course, this was part of the whole thing. What I thought was the problem wasn't the problem, right? It was so many other pieces, right? And so this was one of them, right? That like I went into a state of total dysregulation and probably didn't come back out of it when I thought I did. And so several years back when I was a teenager, I had both my knees reconstructed, soccer or whatever. And both times, I still remember at Children's Hospital, the nurse coming in and her telling my mom or whoever was there with me, because I was a kid, oh, we have to put a second catheter in her. Like her bladder didn't wake up. She didn't pee. And I remember being like, oh my God, this is awful. But it never freaked me out, right? Especially because the surgery's at your knees. There's nothing like near there, right? And I had totally forgotten about that. Right. And after I had the C-section, they took the catheter out. I completely forgot about having needed that and just having a bladder that takes a little longer to wake up. And I was in the NICU, working on breastfeeding, all of that. My son went to the NICU, but there was nothing scary going on. It was just like a precaution for him being a little bit early. And all of a sudden I got this like pain that I've never felt in my bladder. I felt like my bladder was being like ripped open. And I just started screaming. I started crying. I remember part of the nursing staff like wanting me to finish breastfeeding or like keep trying during that pain. And then I said like, it registered for me. Like I need another catheter. Like this is my bladder. Like I think it's overfilling. Like I lost it. And instead of getting me that second catheter, they put me in a wheelchair. They brought me to the bathroom to like, I still remember them giving me like peppermint to smell. Right. And all this time, I knew my bladder needed to be emptied. Right. It was like the anesthesia, for whatever reason, was not moving through that part of my body as it does in most people.
But you were in a lot of pain.
And I was in a ton of pain, like screaming, crying. So finally a doctor walked by that wasn't mine. And he saw me really upset. And he's like, let's just get that second catheter in there. And they did. And they emptied it. And it was very full. And he was like, I'm really sorry. And immediately I felt better. I felt better. Like,
so you weren't able to go to the bathroom on your own then?
No, I wasn't, because my bladder hadn't woken up. Still, like that medication was just still hanging around in there.
Interesting how your body remembered that from last time, from so many years ago.
Yeah, totally. And it's just, it's not the norm, I would say. It's not typical. At least this is what the doctor told me, but it happens. It's not like something's wrong. It just happens in some people. And now I know going forward, if I have any surgeries, to like let them know I probably need a second round because my body takes longer to get rid of the anesthesia. So whatever. And I was fine. What's funny is once they got it out, I was fine. I was fine for the rest of my stay there. When they took the secondary catheter out, I peed fine, no problem, went home. And I was fine for like a few weeks. And then I don't know what happened. It was like a few weeks, with a newborn at home. And all of a sudden that pain came on again. And I panicked. And I was like, oh my gosh, this is what I felt in the hospital. I'm not peeing. So I stopped drinking because I was like, I'm scared my bladder is going to like burst. And my partner was just like, just go to the ER. Just go to the ER and see, So I remember my dad came and picked me up. We went to the ER. I still remember I had to like pump because I was breastfeeding. So I had like all my pumps, and like when you're at the ER, you can be there like forever. So I was like occasionally pumping, coming back to the room to wait. And they finally got me in and they scanned my bladder with like one of those like little ultrasound things. And they were like, it is empty. Like there is nothing in there. It's so like bone dry.
This time it was empty. It wasn't.
This time it was empty. Isn't that crazy? It was empty. And what's even crazier, and this really is one of the things that helped me get through this when I was at my, at a low point, immediately I started to feel better. Like almost instantaneously. Like something about, like they have like, like that white coat syndrome or whatever, where you see a doctor coat and you're like, oh, okay, I feel better. So it was something about like a medical professional and like evidence that it was empty that brought me back, right? And so I immediately felt better. And they were like, and you're super dehydrated, you're breastfeeding, you need to be not only drinking more than you are, but like double what you're drinking. So I started like drinking more water, felt even better. And I remember driving home with my dad, and we were almost like laughing about how crazy that was. How it took me just needing more water because I was dehydrated, maybe irritating it a little bit.
Well, you can irritate your bladder if you don't drink.
Totally. And so that was part of it, probably a real physical issue. That was probably
Right.
part of it. And then when you're breastfeeding, you already need more fluids. So, whatever. And so we were like laughing about it on the way home. And then I was fine. I was fine for like 3 months. And then I remember we had gotten, I was home on maternity leave, with my little one, and I got like a gym membership, and I brought him to the little daycare at the gym, and I'd started working out again. And I went a little crazy working out. I was just so excited to kind of feel like myself again and feel kind of like normal, whatever. And I was working out. I was probably pushing myself a little bit too much. But I remember one day bringing him there 3 months after all of this, just stretching in one of the exercise studios, and it all came on again. And it came on maybe with like slightly different sensations, but just so uncomfortable. Like you had to pee, but you didn't. Like my bladder was definitely empty. Like I knew it wasn't full, but like I felt like I had, the way I described it to doctors at the beginning of this was like there was kind of broken glass inside my bladder. Yeah. And I was like, okay, like, what is this? And I like really freaked out again. And I went back to Beth Israel, which was my original, place where I had, all my appointments and the birth of my son and all of that. And they have a urogynecology department. And they were like, let's get you set up in there, find out what's going on. So they did all the bladder testing. They put me on, which was pretty normal. There wasn't anything like showing that there was like a big issue. And they put me on a medication called like oxybutylene or something that kind of like calms the bladder. And it did nothing. It did nothing. And this time I started to get really scared because the symptoms didn't go away. They didn't go away with going to the doctor. They didn't go away with, here, take this medication. Like the things that had worked before in the doctor's office, no change. If anything, it started to amp up.
And just to say, there was nothing wrong with the bladder when they did the tests.
No, I mean, they had me like pee where they like kind of measured it. And like those urodynamic testing things, they did see it was kind of like spazzy a little bit. So there were some muscle spasms there, but there was no like, it can't hold that much or like anything like that. So I started to panic, and I just, for some reason, was like, screw this hospital. Like, they're the ones that did this to me. They didn't listen to me when I was in pain, and they took too long to give me the catheter. And that's why I'm having these problems. And so that's what started my doctor hopping. Like my panic rush for the doctor who will fix this. And just to kind of fast forward, I probably went to like 7 or 8 urogynecologists because I wanted to go to that new one that would be like, you're going to be okay. Like, this is going to be fine. I always kind of liked that fresh start with a new doctor that would tell me, because I would get scared if I kept going back to the doctor and I wasn't getting better, that they were going to be like, I don't know what to tell you. Like, this is it. This is your life. And I still remember the first kind of like specialty boutique urogynecology office that I went to. I went into this guy's office. He did a little round of urodynamics testing on me. And he said, I think you're going to be fine. You're within the realm of like still healing. Like I was still in like 8 to 12 months of having had my son. It wasn't like, 2 years later, and things can be a little wonky. And he took out this flow chart at his desk. And I still remember this. And the flow chart said like, for bladder problems or pain or discomfort, we start off doing nothing and we just wait. That's step 1. If that doesn't work, and there's like a little flow chart arrow, we try medication and physical therapy. If that doesn't work, and I'm generalizing here, there may be other steps in between. I don't know, but you get the idea. Botox injection. If that doesn't work, like another thing. If that doesn't work, the last thing on that list was the InterStim, right? That like pacemaker that you get in your spine and you kind of control it. And I looked at it and my eyes went like right down to that last thing. With the feeling I'm having right now, I was like, that's where I'm going to end up. Like that was my thought, because I had this visual in front of me and I was like, why would any of those other things work when I wake up every day and nothing's different?
So you expected the worst case scenario to happen.
Yeah. And this doctor like showed it to me, something I never even knew was like a possibility, that I'd have to walk around using a button to control my pain, now I know is a possibility. So again, registering, in my brain, dysregulating me more, putting me in a complete state of fear. And so, I continued to see him. He had some like alternative treatments that, I borrowed money to do them. They probably didn't do anything. I did this crazy physical therapy through his office, which when I went to a different physical therapist, she was like, why are you doing that? It was like this pelvic floor, like strengthening device. And she was like, you have a tight pelvic floor. Like, why are you squeezing multiple times a day on this device? And so then it's like, who knows anything out there? Like, why am I getting two completely different pieces of information of how to get better?
And
right now, who do I even trust?
Too. Who do you trust? Right? One person's telling me this, one person's telling me that. Talk about keeping your brain on high alert.
Totally. It's like, does anyone know how to help me here? Right. So I left. I started to feel annoyed with him. And so the new physical therapist that I went to, that in a way made me feel better, because I was like, well, if I'm not getting better with him and she's telling me to do the opposite, maybe there's hope here. Right. So I jumped ship. And I'm like, okay, I believe everything you're going to tell me. Do you have a new urogynecologist for me? And she did. And I went to this new urogynecologist. And the whole time my diagnosis was overactive bladder, even though I wasn't overactive bladder. Like when you see like the commercials and all of that, it's like you have trouble holding it, Right. I remember thinking like, I would give anything to just maybe have to pee a little bit right. and not have pain, and obviously anyone who's living with that, I'm sure that's not their experience, but in that moment for me, I was like, I'll put a pad in my underwear and like pee a little and not have pain. And that's what I imagined when I heard the diagnosis of overactive bladder. So I was like, I feel like you're not getting what I'm trying to describe here. So when I went to this new urogynecologist, she was like, I don't think you have overactive bladder. I think you have something called interstitial cystitis. So, I was a little excited to have like a new diagnosis, because a new diagnosis maybe meant a new treatment and actually fixing the problem. So she put me on amitriptyline and continuing with PT. It didn't get better. It stayed the same. And so I eventually, and a little bit with that doctor, I started to feel like the more I went back to her and kept saying like, it's not better, there was a twinge of like, me annoying her, which also didn't help. Like, I don't want to be here either. Like, I don't know what, I don't know what you're doing right now. So I left her because I felt like that was it. And then I went to a different hospital in this area, Mass General. And again, this kind of started off with, I saw the head of the whole urogynecology department, like the chief surgeon, and she was very calming. I did feel like better talking to her. And she had a lot of she said some things that now, having found TMS and found kind of the information around neuroplasticity in the brain and pain and all of that, I'm like, wow, she really was on the right track with some of the things she said to me. But I didn't have the information I have now for that to be able to help me, because exactly. she didn't name it. She just said, then instead of saying, this is her line to me, instead of saying no when you get bladder pain, say, oh, well, and I thought I was going to lose my shit. I was like, you say, oh, well. I was like, I don't know if anyone else now, a year or two into feeling like you have to pee every second that you're awake, would be able to say, oh, well.
There has to be some more explanation around it. And
totally.
To be honest with you,
she was so close.
Looking back, she was completely on target.
Totally.
But there wasn't any of the neuroscience. There wasn't any of the education. Oh, wow.
Yeah. And if she was like, just had like a little piece of like, because right now what's happening is the pain's being generated from your brain, I would have been like, wait, what? And I could have bought in. But instead, I'm like, how can I possibly say, oh, well, I barely can make it to bed. My goal every day is to parent my child and fall asleep. Every day was on repeat of that. Like,
and it can feel very invalidating when someone just says, oh, go well, oh, well.
Yeah. And she was very kind and obviously very, an expert in her field, but not about what was happening to me. And so, I started getting injections. I got, steroid injections and just like numbing injections in my pelvic floor. Right. And the whole pelvic floor thing, I think pelvic floor PT can be really helpful for a lot of people for a lot of things. Again, now for me, looking back, I've probably had a tight pelvic floor my whole life.
Right.
it wasn't the reason for this. And so whatever. But that's not to say that I'm sure it helps some people, and there are some things that pelvic PT, just like PT in general, really helps with. Right?
Absolutely.
So I just want to say that it just wasn't.
That's important
looking
to say.
back. Yeah, I think that's important to say, right? Because it is really helpful. People need to work on the physical piece of their body. But at this point, I'm heading into 2 years of pain. That's not what was happening for me.
Yeah, there was probably nothing physically wrong with your body.
Right, right. And so, I was like, I need to go to just the urology department here. So I met with the urology department. I met with just, the gynecology department. I kind of got all the departments together. I don't know how. And I was like, you need to go inside and look around. Like, you are going to find some like big mass in there or something. And they agreed because they knew I wasn't getting better with all of these treatments. So I ended up having like a minimally invasive surgery where they went in and looked around. And did they find stuff? Yeah, they found stuff. Had a C-section a couple years ago. So this isn't like native tissue in there that's like not been in some way, previously maybe damaged a little bit. So there was scarring. There was like some attachment of like my bladder to my uterus. They found endometriosis, which is a whole other topic, which could be really interesting to think about. And I was like, oh, is it endometriosis from my bladder scar? Like it developed recently? And they were like, no, it's just there. And I was like, I've never had symptoms in my life that are typical of endometriosis. So I thought that was really interesting to hear.
That is so interesting because they
Isn't
had
that
told
wild?
me that I have some endometriosis
Yeah.
and that could have been the reason that was, causing my pain at the time. So it's really
Yeah.
cool to know 100% they saw endometriosis and it doesn't have to be the cause of pain.
No. And I think this could be really helpful for obviously so many people with uteruses to like learn that.
Right.
And to start implementing this into their lives. So they did the surgery. They went in. They scraped off some stuff. There was like a scar that she cut off. Whatever. And then I recovered from that. I actually felt, which I thought was interesting, a tiny bit better after the surgery. Like I had a little bit of relief. Not 100%. Like not anywhere close to how I feel now. But like I remember feeling like, oh, I feel like a little bit better. And then a week later, it all came back. Right?
Do you think it was the placebo effect?
Probably, for sure. I think I was like, finally someone went in, they took some things out, like that was the problem, And they also did like a Botox injection while they were in there, apparently. Like when I read the report, I was like, oh, I didn't know I had that. So anyway, so it all came back. And at this point, I go back to see the urologist and she's like, all we got left is the inner stem. So I've kind of gone through everything I possibly can go through. And now it's the inner stem. And I was just really sad about that. I think that's the best way to describe it. I was so sad that, this happened to me and now I'm going to have to get this, procedure done and this implanted into my spine. I was so upset about it. I started talking to a therapist, and the poor therapist, I mean, she was great, but it was like there was nothing that we were going to talk about in therapy that was going to help this issue, right? And talking about my feelings or like it's like it was not touching on this. Right. And she acknowledged that. And she was like, okay, I'm going to reach out. Like, clearly this isn't what you need. Right. She's like, I'm going to just kind of like cast a net to my network of therapists, right? From like around here, New York, whatever. And just kind of explain what you're going through and like maybe someone else. Right. Because obviously my mental health, I mean, it was bad. Like, I was like, I can't go on like this. How can I? Like, there must have been something in me that felt like one day this will be gone because if there wasn't. I mean, I had told my partner, I was like, you need to go. Like, you need to move on with your life. Like, I have nothing to offer you. Nothing. Like, I need to get to bedtime. I need to not let my son see me upset. It takes everything in me to have to pee all day and have fun playing with him. And there's nothing I have for you.
You were just making it through the day at those times.
I was making it through the day. Like, my best part of my day was when I was asleep. And so she did that. She reached out and she came back to me and she said, okay, because at that point they had found a little hernia. Mm-hmm. Right? You go in, you keep looking, you find stuff. So they found a hernia and because I had an MRI at some point. And, she had found someone else. Actually, it was another therapist that was a colleague that also went through a bunch of surgeries, a bunch of pain, hernia on the side, and had found the work of Nicole Sachs. So mm-hmm. Nicole Sachs was the first name I had heard in this new world right. that I discovered, right? And so I was like, Okay, so I got in touch with this other therapist or colleague who was also potentially going to get a hernia surgery but didn't because she was like, let me try this first. And so I was kind of similar, although mine was more bladder than pelvic pain, whatever. I was like, okay, hold off on the hernia surgery. Definitely hold off on the inner stim. I started to look into Nicole Stack's podcast. And then in her podcast, you can sort and filter, and I looked for anything bladder related. And so much of it I could relate to. I started finding other names, like through getting some vocabulary words through her, like TMS and neuroplastic pain and perceived danger pain, and like all of those things like led me to the different experts in the field, right? It led me to, Alan Gordon, and I think you had responded on something related to pelvic pain and bladder. And so I found your name, and, I just started reaching out to people, and that didn't heal it immediately. It probably took me a couple years, but it definitely was clearly the answer, right? I started to feel little pockets of time where I would notice it changing, right? So even just having the information of the brain and how the brain responds to fear and thinking about my experience, right? And how I went into total fear mode. And I'm also parenting now with a lot of pressure on myself and stress and worry. It made so much sense that my brain was like, oh, here's a direct path to like alerting her to everything that could be going on, right? And then I had that physical injury, which was like the perfect intersection of those things to keep me in pain, So I started off by listening to podcasts, and I think after that, I think I started talking to you, and that was really helpful.
And I'm just curious, we had a consult on the phone. I
Yeah.
don't know if you remember,
Yeah, I
but
remember.
I remember. And I'm just wondering how you were even just after the consult.
Yeah, I still remember that moment. I remember I was at my parents' house, and you were so funny. You were like picking up my daughter at like a New Year's Eve party or something, and I'll call you in a couple. Can you talk in 10 minutes? Like, it was so funny, and I was like, okay, sure. Like, I was so excited to talk to someone because this was the first time. Now I'm reaching out to someone who can like coach me and like explain a little more one-on-one on this. And you had me do this exercise with my hand, with sensation in my hand, right? So it was a quick consult, but you were like, just try this. And after I finished that, it wasn't gone, but it was different. And I was like, that is fucking crazy. I was like, that's crazy.
I remember you texting me and you said,
Yeah.
I'm feeling a lot better after our consult.
Yeah. And I think the first step for me was just calming down a little bit. Even if like the actual bladder didn't necessarily change too much, there was something soothing about just calming down, like feeling safe, right? And of course, like, I'm on 3 years now of pain. Like, a quick conversation isn't going to like permanently change me, but it was the nugget that I needed to be like, this is the way.
Yeah,
This
just
is
so
the
you
way.
know, it's not like I do something magical on these consults for anyone that's
Yeah.
listening right now. This wasn't that the consult changed anything. What happened was, I believe I gave you some hope.
100%.
I made you feel safe, and I gave you a very quick technique to show you that there's sensations in your body other than your bladder.
Yeah, totally. And I remember just feeling like, wow, like that is really interesting, right? And, and then the path from there was, for me personally, and I know different things work for different people, somatic tracking has been really helpful. So taking 10, 15, 20 minutes. I started off with my somatic tracking with a real isolated amount of time, like in a separate room, not disturbed, using like either a recording that we had one time when we had a session, or you can find other ones online, like some of these meditation apps have them, Curable has them, and I would do that. And then, at one point I hit a little bit of a plateau where I was definitely accessing life a little bit more. Like, my goal wasn't to get to bedtime, but I still wanted to be more comfortable. And I started to learn that I can do like a 1-minute one. I can sit in my car and not try to hold back the sensation, but give it some space to unfold and let myself fully feel it. Because when I would feel it at school, right, as a teacher, or I would feel it just out and about during my day, I would get really annoyed and I would feel really upset. And I would start to look around at all these other people that just live normal lives. And I would feel I would compare myself to them and I would be like, my life is terrible. And so what I started to do was do these kind of like mini somatic tracking sessions, which were so accessible, right? And I noticed that that started to really help. And then it just started to kind of snowball. And what I learned about my brain was like, just by doing that work, like let's say I did that 1 minute mini somatic track, or I just didn't lose my mind and like flip out and start thinking about how unfair this is for a day, right? I wouldn't necessarily feel better immediately. And this is what I learned, like looking back on it, but my brain was registering it for later on, I think, and so I was starting to lay the foundation of these pathways in my brain that I could slip into more permanently later on. And so, I think like when I think about people that are kind of in the thick of it right now, if you're doing the work right now, don't think that it's wasted because you don't feel better right now. It's coming, right? I think that was like a huge like realization that I had like more recently as I've been better more consistently.
I love what you just said, and I wrote it down even. You were
Oh,
laying
cool.
the pathways that you can slip into
Yeah. Yeah.
later on. I
Yeah.
couldn't have said it more beautiful in myself. It was perfect because that's what we're doing. We're creating new neural
Yeah.
pathways in our life.
Yeah. Yeah. And I think like, wow, it was really tough. And I've always felt like people who had this, right, and were free of it, it just, it felt good to talk to them or read about them online or listen to podcasts or videos or whatever. Obviously, because you're like, okay, I can relate and there's hope. And it also felt like it was this club that you couldn't get into. Like, let me in, please. I want to be in the club and I can't, And so I think those reminders of like, it's coming, you need to be patient
Yeah.
and it will,
So I'm kind of curious, when did you realize that this was a mind-body condition, or what were some of the things? Was it the exhaustion of the medical community and you had nowhere else to go? Or, was it just listening to podcasts and success stories, or was it a combination of both?
I think it was a combination of both. I mean, even up to like a year ago, if you were to tell me, no, Heather, take this pill and you'll be better, I'd be like, give me the pill, So now I would never take the pill. Now I'd be like, why would I take the pill? The pill is going to stop working. Like, this is permanent. This is where it's at. So I think the medical community, I was still looking and relying on a medical fix for a very long time because it felt easier in a way, But then, when you start to get these little moments, and they don't have to be big moments, like one of the first indications that, and I shared this before, I forgot to share it right now, that I was like, whoa, like this is really weird, is I would go all day with my bladder symptoms, but what started to happen was when it was bedtime and we were in my son's bed and it was book reading. After that, it's lights out. They would go down significantly or gone. And that was crazy. That was like, this is crazy because it was all the time. That was the pattern. All day I would have them. And then I would be in bed reading and the day would be over. And it was like this chunk of time where it was like I didn't have to feel guilty because he needs to sleep. It's nighttime, that I wasn't playing or doing the right things or making the healthiest food or parenting in the right way. There's so much pressure around parenting now with like social media and the right thing to say and the wrong thing to say and whatever.
There is a lot of pressure to be a mom.
It's crazy because you're like, we all, parent better, and we've learned, but you're also just doing the best you can, than previous generations. But then it's almost like a script that you feel like I feel like that you have to stick to. And I would be like, oh, I think I didn't say that right. Or, now do I need to repair? So I was like, in that spiral a little bit, but there was something about bedtime where I felt like the day was over and there was nothing to feel guilty about. There was nothing that was coming next, right? The next meal to make or kind of just, activity or meltdown or whatever. Like it was over. And there was something about that where the responsibility had lowered. So the pressure on myself had gone down and I started to have no symptoms at that time of day. And that lasted probably for a few months, to be honest. I have symptoms all day and then I was bedtime, gone. It was so weird. And then I started noticing it, like if I got super distracted with something enjoyable, like we had friends over and we were having pizza and the kids are playing in the backyard. And I would just be like, well, hold on a second. I don't remember thinking about my pelvis, my pelvic pain, or my bladder, which was so different than like when I was in this spiral of like, because my bladder pain was crazy. Like once a month, I would get like this lower back pain that would like travel up my spine, and then I would get a sore throat. And I didn't really care about that. Like I was like, whatever, I have low back pain and a sore throat for like 12 hours. Like I don't care. You can give me that every month. Like take care of the bladder pain. But I remember obsessing, like, I'm not explaining, like they're not understanding my words. I'm not using the right language. I'm not explaining it in a way that's getting the doctors to understand and be like, oh, that's what it is. You need this medication. And so I would try, I was like making myself insane. I was like, oh, if I tell them about the back thing and the sore throat, they're going to be like, oh, we know what it is. And I would tell them that and they'd be like, what? Okay, we'll give you more injections. Like, but it was so much pressure on myself.
If you think about all the symbolism here,
Yeah.
You were having bladder pressure and pain, and you were putting external pressure on yourself, and then you had sore throats, and you felt like you weren't able to express yourself enough.
Yeah, there we go.
Talk about symbolism in two parts of the body.
Oh my God.
Right?
It was wild. Yeah. So, I mean, obviously I've left out some details, but we'd be here forever, but hopefully.
Right. No, you did great. And I just
Thanks.
think it's just so interesting how everyone has a different path. Okay.
Totally.
And I remember our sessions completely. And for you, like some people like breath work a lot, some people like journaling a lot, and there's no right way for everyone to go. You have to figure out what works for you. And I remember our sessions specifically, and the somatic tracking and the somatic experiencing worked for you. And I remember when we would pay attention to your bladder and we'd do certain things, your symptoms would go away.
Yeah. Yeah.
But it's not the right path for everyone.
No. And I think some people really benefit from journaling, and some people really benefit from breath work. And that's awesome. And, and I've said this before, it's like whatever that is for you, like that tool, awesome. But it has to be with that foundation of, I know this is what's happening, right? This is the brain. And then with that confidence, and that's what it is, now these tools are here to support my healing. Because if you're just doing it, but like, oh my God, I can't wait to get that next injection, like it's probably not gonna be as helpful.
So how has this impacted your life now? How do you see life or do life differently?
Yeah, I mean, I've said this before, I feel like I'm still pretty much the same. I feel like I've learned something really cool and like, and I think it's important to say, because so many people probably listening to you are like, well, I'm not, I'm hearing all these stories of people that are just totally fine. Like I have moments, like especially before my period, I'll feel like a little like, oh yeah, here it is, this familiar feeling, but it is so much less. And I still find if I get busy, if I get into life rather than pulling away from life, it goes away. Right. And so I just feel like I am enjoying everything more. Like I'm enjoying parenting more, whereas like I loved parenting and I felt like I had this thing that was like pulling me away from it and keeping me from being totally present. So I just love being like, a mom to my son. I took a year unpaid leave from school, which was like not in my personality to do. And we're going to Italy for the year. I know. And so, to say like having this is why I'm doing that, no. But I just feel like, you learn to access the present moment better once you've kind of learned these techniques and you've kind of understood how your brain is working. Because when you think about like anxiety or panic or worry or rumination, right? You can use a lot of this to kind of regulate yourself again and just get back to accessing the present moment, I feel.
So tell us, what are you up to now besides going to Italy? Are you exploring any of this mind-body work at all?
Oh, thank you. Yeah, I feel like, when I first really started to feel better, or like even when I was on the path to feeling better, I was like, I know some people become coaches. I was like, F this, I am out. I am like, I want to forget this ever happened. I want to like have nothing to do with it. Don't talk to me about it. I don't know what you're talking about. Like I want to move on. And then it was just this constant reminder of like, God, like 3 years of seeing doctors, like not one of them could have dropped like a little nugget. It's just like almost like I just feel like I have a responsibility now to like share the information. And for the most part, if there's like a lot of times in my yoga class, like, I won't overdo it because it's not really the purpose of my class, but I will mention sensation. I'll sometimes give a little, depending on the class, like quick history of like my story. I just feel like I have a responsibility to like get the information out there, because clearly people are still getting all these surgeries once it's been clear that there's not like a physical detriment to them and they're in chronic pain. Just even for my own knowledge, for trying to like support people in exploring this path, just doing like the pain processing center's like online course, and just feeling like along with my personal experience, I also have like some knowledge of the brain to continue to just spread the word, get it out there. I've emailed all my doctors. No one's emailed me back.
Well, yeah, that sometimes that won't happen. I've emailed all my doctors too, and they don't email me back as well. So that,
I just think about, I don't know, all these people getting the inner stim that maybe don't need it.
The two of us were this close to getting it.
This close. Because at the end of the day, I would have gotten it. Like, I couldn't have gone on,
Mm-hmm.
But the amount of stories I heard of, like, they got it and it didn't help.
Right. Yeah, that's what stopped me from getting it too. So, which I was happy that I heard those stories, because at least I didn't get that surgery, Yeah. But I'm just wondering if there's one last thought you'd like to leave our listeners with. What would it be?
Oh boy. Okay. Let me think. Talk to you. Sign up before. Oh, you know what I would, say is just catch yourself, because catch yourself in this kind of healing realm of mimicking the same behavior that you had in the medical field. The chasing, the new TMS practitioner, because you can easily replicate that. The kind of the urgency, the desperation. Catch yourself in that place while accessing this work, because I think that'll kind of, you'll still get help, you'll still feel better, but it's one of the things that generates pain, right? So
what a great tip. And I think that's the first one.
I just came up with it.
That's the first time anyone has ever said that before on the podcast. So that's fantastic. So
thank you.
I just want to thank you for being here. And I also want to just applaud you for doing this, because it's not so easy to share your story publicly. And I am so proud of you and so honored to have been part of your journey and helped in your healing. But you did the work. And I am just awed by the courage that you've had and the perseverance to continue this work and to keep spreading the word. So thank you so much for being here.
Yeah, thank you, Laura. Thank you for everything that you're doing. You're amazing.
Thanks for tuning in to this episode of Beyond the Pelvis. I hope it gave you something to think about, feel into, or just a reminder that you're not alone on this path. If you're looking for deeper support, check out the Pelvic Healing Circle, a live guided space with somatic practices, breath work, and a real conversation to help you feel more grounded and connected to your body. And if this episode spoke to you, share it with a friend, leave a review, or come say hi. I love hearing what resonates. Until next time, keep listening to your body and be gentle with yourself. You're doing great.